What up? My name is Mitchell. I'm a pharmacy student, and I just started my APPE rotations. In this video, I'm going to cover two of the rotations that every pharmacy student has to take, which are the Intro to Health Systems Pharmacy and the Internal Medicine APPE rotation. And my goal of this is just to reflect on the experiences to better prepare you for experiencing them in the future. Because when I was a student, it's like nobody wanted to talk about APPE rotation, so I knew little about it. So I'm here to help you out, and we're going to get down at the bottom of this. Okay, so here are the two rotations. You'll see that the Intro to Health Systems was broken down between IPPE and APPE, and that's because COVID ruined the IPPE experience a year prior, so we had to implement that 2-week IPPE rotation into that. And then the Internal Medicine APPE was also 6 weeks. All right, so this is what I'll be covering. Basically just how time demanding were these rotations? What were the expectations in terms of the preceptors? What tasks did I do during the rotation? And I'll have very specific numbers and tasks that I did. The level of enjoyment and growth. And then also I'll be wrapping up with a concluding reflection where I just sort of elaborate on what I took away from the experience, what could have gone better, etc. All right, so here's the Intro to Health Systems. First off, this was at a big hospital of over 200 beds. So I was a small fish in a big sea. The hours were about 9 hours a day. I had very little work to do when I got home, and I live right next to the hospital, so it was a short drive. The timing fluctuated because I was with a different preceptor every 2 days. So some days when I was working in the ICU, I might start at 6 a.m. Other days when I was doing late night med histories, that was between 3:30 p.m. and midnight, which was atrocious. So the time fluctuated a lot because I was jumping from preceptor to preceptor. Now for the first 2 weeks, this was the IPPE rotation. So I was working with technicians, primarily doing a lot of busy work. The next 4 weeks was when I was jumping from pharmacist to pharmacist and learning the tricks of their trade. They were pimping me a lot. I was doing different tasks, etc. Now, I could only answer about a quarter to a third of the questions. And even though I did feel stupid sometimes, because a lot of the medications inpatient are different from outpatient. Like when I was in school, I thought I would never experience rapid sequence intubation medications, but I see it all the time in hospital. So prepared to be able to make that adjustment and adapt on the fly, because you're going to see a lot of meds that you're probably not familiar with. But the key point of this is try to establish a healthy communication with your preceptor. And if you don't know something, don't pretend like you know it. Just be open about it and say, I don't know. And that way you can maximize the learning experience. And if you know little bits and pieces, try to throw that out. So say, yeah, I know this is used for that. And then you could sort of weasel your way to the right answer through talking about it. All right, so here's the Intro to Health Systems sort of layout of the pharmacy technicians. Now, even if you are just doing the APPEs, it's important to know this process of how medications are being moved. So in the morning, the returning technician gets a delivery from a delivery person and they scan it in saying, okay, I got the medication. They send the medication to the stocking or polling tech who scans it again and puts it in a medication carousel or a shelf for storage. And they're also they're responsible for pulling prescriptions. So if patient in room 412 needs atorvastatin, they're going to pull it, scan it, prepare it, and then send it to the pharmacist to verify it. Once that's done, the delivery technician is going to grab all those meds and run it up the floor to the fourth floor, wherever it's going, and put it in a Pyxis machine so that nurses and doctors can grab it out of there instead of coming back down to the central pharmacy. There are some other responsibilities of technicians. You have the IV room techs who make IV formulations, and they also work with TPN machines, like you can see in that picture. You have med history techs who are only responsible for interviewing patients and getting that information. And then we also had a triage tech who would do all of these tasks except for the pharmacy verification if a person needed help and if they're being overwhelmed. All right, so here are the tasks. These three were the IPPE tasks with the technicians, but then when I was on the APPE rotation, I made a change alert. I did some warfarin notes and Venco notes, and I got pimped a lot. And this was very different depending on who I was working with. So the pediatric pharmacist would ask me a lot different questions than the ICU pharmacist. And when you're going into a position like this, you need to know who you're talking to and who's your audience, because you'll learn what to expect with them. All right. So the level of enjoyment it was okay. I enjoyed it more than I learned. I really didn't learn a whole lot because I didn't have a lot of freedom to practice clinically. It was more like I was shadowing the person that I was with each day. And it's almost as if they didn't expect me because I was jumping around from person to person. They're like, oh, I'm with the student today. Okay. So I didn't learn a whole lot. But when I came home and I did my own individual study, I learned more. It was very difficult for me to adapt to each new pharmacist every day or two. I would much rather have one preceptor the whole time. That way I can build and grow with them. Because the truth is, every pharmacist has a different preference when it comes to writing vancomycin and warfarin notes. And if you learn it with pharmacist A, and then all of a sudden you're on pharmacist D, and they're like, wait, why are you writing the notes that way? It's like, because I learned it from pharmacist A. And pharmacist D is like, no, you're doing that completely wrong. Do it this way. And it's just a pain because there's just so many different ways to do it, and everyone has their preferences. Now, I did like this big hospital because it provided a lot of diverse experiences, just going to the different floors, seeing different patients and different units. And it helped me see the big picture, especially doing the IPPE tasks. All right, now let's move on to internal medicine. And then once I finish up with this, we're going to compare the two and do a final conclusion. So here's the internal medicine. And everyone has to take this. Like I said before, this is notoriously the most difficult rotation for APPEs. And after I talk about it, you'll probably understand why. So compare this to the 9 hours a day with the other rotation. We're looking at around 11 to 16 hours a day. I had no life when I did this rotation. And chances are you probably won't either, even if you do have a preceptor who's a lot more casual. So I did have a consistent schedule, but I always stayed late. There were 2 days out of the 6 weeks where I actually left off time. So think about that. And I did have to spend a lot of time driving. It was about a 30 to 45-minute drive to the location. And then I got plenty of reading every day. So I would come home after a long day, and then I would have hours of reading to discuss with my preceptor the next day. The expectations were high compared to the expectations that were low at the other location. This is because I had experience with vancomycin and warfarin consults, so my preceptor expected me to know how to do all that. And really, the high expectations came down to time management. As you'll see when I go through the tasks, I had a million things to do. And on top of that, my preceptor was constantly hounding me with DI questions. And if any nurse or provider asked him a question, he would refer them to me, and then I would have to immediately find a solution and then contact that person. So as you can see, this became a pain, and it was really difficult to manage all these things at one time. My preceptor also had some unrealistic expectations. One that I remember is, usually we use a ClinCalc vancomycin calculator or a calculator for your institution. Now, he wanted me to calculate vancomycin peaks, troughs, doses by hand. I hadn't done that in 2 years. And he was putting a lot of time pressures on me. I would be calculating it out. I had like a whole page of information, and all I would see is him crossing his hands, like looking over at me. Are you almost done? You almost done? You almost done? It's like, dude, I'm trying to figure this out, and you're putting this huge time restriction on me. So you're likely to experience something like that in the future. Maybe not in terms of vancomycin hand calculations, but that is something that you're most likely going to see in the APPE rotation. All right, so here are the tasks. I'm not going to go through all the tasks, but you can see them there. Mostly it was med history and then warfarin and vanco notes with a lot of DI questions. This is what my typical day looks like on rotation. And you can see that I start in the morning with the notes, usually takes me about 2 hours. And then I work up patients for med history. And then for, like 5 hours or so, I'm actually going and I'm talking to patients. I'm tracking data. I'm working on this project. And then I'm entering it into EPPE. So the med history took up a substantial amount of time. And then after that long day, when I was still there, I would talk to my preceptor for about 30 minutes for the home readings that he would have me do. I remember the very first day of rotation with him, he gave me a 54-page paper and he said, read this, we're going to discuss it tomorrow. It took me like 3 to 4 hours to read this damn paper. And then I talked to him about it. This is a daily thing with this rotation, at least for me. He would give me hours of reading and then we would discuss it at the end of the day. And then once he left at 2:30, I always stayed for, even more time because I had a ton of things to do. If any notes came up, I would have to do them. If any med histories came up, which they always did, I would do them. And then I also worked on my project. And I'll give you a little bit of information on this project. The hospital that I was working at, it was a small hospital that only had about 30 beds. They didn't have a technician who did med history there. I was responsible for doing all of their med history consults, which is why I did 125 in that 6-week period. So what I did is I did all the med history interviews. And then I was also tracking data because I had to come up with a plan for how they were going to do med history in the future. So this part took up a ton of time. But apart from all that, I would come home, like 5:30, and then I had hours of reading. I would eat dinner, maybe get an hour or two of free time, and then I would go to bed and repeat the process. So it is mentally draining. And even if your schedule doesn't look like this, internal medicine is rough, and you should be just mentally prepared for it. Also did journal club, talked to some providers, nurses, answered questions, and then did some discharge counseling. All right, despite that huge amount of workload, I had a great time. I had about a 9. This would be a 10 if I didn't get stressed out during this rotation, but it's going to happen. The level of growth was a 10. I was a big fish in a small sea working in this 30 bed hospital. I was able to practice as a pharmacist instead of in the other location where I was more so shadowing pharmacists. Concluding reflection, I learned a lot more working with one pharmacist versus working with a ton of them. I was able to pick his brain, really learn his practice, and he was a great preceptor. Like I said, smaller hospital, so I had more freedom. And this is really important. Working in a small hospital is going to give you the luxury to do more. So take advantage of that. But I was busy the entire day. There was a high risk of burnout. There was only a few days where I thought, wow, I'm really stressed because I don't have enough time to do all this stuff. All right, so this is the final slide. I just wanted to compare these two rotations and wrap this thing up. The hospital size is essential in terms of freedom. Now, you could be working in a large hospital with one person and have a lot of freedom. I didn't have that. So really, it was a watch me do this versus do this approach. When I was with all these preceptors, I was watching them work and asking questions. When I was in the smaller hospital, I was basically a practicing pharmacist who was doing everything. So that is a big different approach. The time demand. Internal medicine is crazy high with time demand. So remember that. The expectations are also higher because you do have a little bit of experience under your belt. Now, in terms of these notes, look at these numbers. I was doing way more, and I was a lot more effective and efficient at doing the notes in the med history once I did them over and over and over. The DI questions, I had a lot more DI questions at the internal medicine site, but at least the DI questions here were consistent. When I was at the other site and I had different preceptors, they all had a different expectation and preference for what they found important. So the DI questions were all over the place. There was one day where I was working with the OR pharmacist and he pimped me on ID questions for 7 hours. That is not a joke. Well, the entire day was him asking me infectious disease questions. The home readings are important. Internal medicine had a ton, had a lot more project work too. So overall, internal medicine was a lot harder than the other rotation, but I got a lot more from it. And now that I've finally concluded with that, talking about the differences, The last thing I want to do is just give you a piece of advice moving forward. The number one thing you can do is try to be assertive when you're in these rotations, because at the end of the day, the experience that you have is based on what you put forth. So in this rotation, I wasn't really reaching out and trying to make the most of it. I could have said, hey, can I do that warfarin note? Can I do that Venko note? Can I go do something? Instead, I was waiting for them to initiate it for me. Whereas internal medicine, I had, even though my preceptor was available, I was basically an independent entity where I was working on my own, being assertive, doing my own thing. And that stemmed from communication. So if you can communicate effectively and really set the standards initially with your preceptor, talk about goals, expectations, what you want to do, what you don't want to do, what you're not comfortable with, that can pay huge dividends in the future, especially during the 6-week period. So I hope this helps somebody. If it helps at least one person, this video is a success. And if you have any questions, leave a comment. I'd love to talk to you about, what you're excited about, or any rotations, if you want to specialize, all that jazz. So hit me up. I'd love to talk to you. Thanks for everything and have a wonderful day.